Thanks, everyone, and thanks for all the great presentations. It's been great so far. So I think Nell is sharing the slides, so I'll just introduce us while she's doing that. So my name is Rachel Vaughan, and I work at the Cascade Research Centre at Cardiff University, and I'm the engagement manager there. So I kind of am a specialist and lead on public involvement work. And then my colleague Nell Warner is a researcher at Cascade, who does loads of lovely research that she will give some examples of a bit later. So what we're going to do today is just a really quick whistle-stop tour of our public involvement at Cascade, which is what I'm going to talk about. And then Nell is going to give some examples from her work about how public involvement has influenced it and what that has looked like. So, Cascade. So, we're the Children's Social Care Research and Development Centre. So, we do all sorts of research around children and families and social work across Wales and wider. And we're the largest in Europe, focusing just on children's social care. Approximately almost 50 staff at Cascade. So, that's researchers and support staff. About 40 PhDs. And then we have a range of other kind of researchers affiliated with this that have specialties and expertise in social care. We do all kinds of different research using all different methods, so reviews, lots of qualitative research, RCTs, and cohort and routine data studies. So at the minute, we have 10 SAIL-based projects that are led by us at Cascade, but we are also involved in a range of other projects that work with SAIL as well. So the next slide, please. So Claire and Jack have already kind of covered this, so it's difficult to know exactly what to talk about and how to frame public involvement when you know other people are talking about it as well. But just very briefly, just to frame the work, and this is from Health and Care Research Wales and NIHR's guidance. When we're talking about participation in research, we're talking about people that take part for data collection, so maybe are being interviewed for a study, or taking part in a survey, that sort of thing. And then engagement, again, we're talking about kind of sharing information or that initial engagement where we're talking about Cascade as a centre. And at Cascade, we have an exchange network that does a lot of this for us. There's a lot of online webinars and resources to share research in social care, both children and adults. And then involvement, which is what I'm going to focus on and what we're talking about here, is really when we're thinking about steering a project or really getting involved in shaping a project when we're doing research with people that have lived experience, rather than kind of participating where we're researching kind of on somebody. That can take a lot of different forms, as we've already heard today, and as I'll talk about a bit in a minute. So the next slide, please, now. Fabulous. So the picture of me with some of our lovely members of our parents group. So the children's social care context is really important for us, and to think about how we frame our work and the way that we work. So we are working in a space where our public contributors and the people with lived experience of this area have often experienced very difficult circumstances and traumatic events in their life. And in addition to that, they've also had a range of experiences, not always positive, where they've engaged with services and agencies and quote unquote professionals. So when we're doing our public involvement work, we're working within that context. So we really need to be thinking about kind of building relationships and building trust, and with a real awareness of some of the stigma and shame and hardship that the people that we're working with may have experienced. And then within that, we want to talk about research, often in these very difficult areas. So whilst we're talking about how to recruit to a study or shaping a research bid like Mayara was just talking about, or what research methods to use, they're still within the context of very difficult topics. So we are always really conscious of how we work with people in that way, and that's really framed some of our models. So the next slide, please. So as Jack talked about, there are lots of different models for involvement, and he gave a really good example. This one I've picked here is from NIHR guidance. And so the link is underneath, so for when they share slides, you can pick up on that. So similar to how Jack shared one that was kind of not hierarchical and not kind of vertical, it's horizontal, really thinking about what's best for the study, what's best for the people that you involve, what they're interested, what kind of level of involvement they want to have, and really thinking of it as a continuum rather than a hierarchical way of getting involved. So this model, I mean, there are lots of differences between the 4 different points, and there's more details in the briefing notes, but we're really thinking about sharing power here in the decision-making process. So between consultation, collaboration, co-production, and control, that's some of the key differences. So with consultation, similar to kind of what Jack was saying, that you're consulting with a group of people, but they have no control over what you will take away from that. So that it's really in the researcher's control what changes they make or what they take from a session. When you're collaborating, there's a bit more negotiation, a bit more sharing of power. You might come and work with your public contributors a number of times, and you're sharing elements of decision making there. Co-production really should be a sharing of power entirely, as much as you can at the right points and in the right kind of things that are based on people's assets. And then control would be kind of, I guess, user-led research. And you can see quite a lot of that within the community. That's definitely not something that we've quite got to at Cascade, for example. But what I would say is that thinking of it as a continuum means that you might be aiming for co-production in a study or in a particular element, just like Mayara was talking about in terms of kind of trying to co-produce a research bid or a research grant, or perhaps in a dissemination element. But there are lots of reasons why you might not quite get there. It could be time, resources. It could be that actually the people that you're working with, that's not what they're interested in. Maybe they only want to collaborate. So there are lots of things at play here, and sometimes what you design and what you intend isn't quite how it works out. And right, to my final slide, please, Nell. So this is a model of how we sort of work at Cascade. So we've got some core groups that I'll talk about very briefly now, and then some project work and work with partners, and that's sort of how we split up our public involvement. So thinking about all of the barriers and the context in which we work with, we have some core standing groups that we work with regularly, which means that we can build relationships, we can recruit slowly and meaningfully and develop those skills and confidence building and empowerment with the people that we work with to make sure that they get involved kind of safely and in the way that works best for them. So we have 2 research advisory groups, Cascade Voices, which is a care experienced young people's group that we run in partnership with Voices from Care Cymru. And then we have a parents group, which we hold at Cascade, which is a group of parents that have had social services interventions in their life. Most have been child protection, and a number of the group have had their children permanently removed. And then they comment on a number of our projects, and we meet regularly. And then we also have an involvement board, which is, again, a range of people with lived experience from kind of foster care to adoption, to kind of being in care, being a parent and being in care. So a range of experiences, and they help steer us as a centre to kind of really set that governance tone for Cascade. But those groups alone do not meet the needs of all of our public involvement at Cascade, because we also work with kind of with a range of other groups and research in other areas, such as kind of exploitation or foster care and things like that. So we have project-specific work that we also do, where we might set up a separate project advisory group, often in partnership with other organisations. And we also have peer researchers, so really kind of committed to that kind of co-production of work where we can. And we also have some ongoing partnerships with partners where we kind of do one-off bits, particularly for bid development if we're looking to work in other areas. So that's our model. And that's just kind of a real whistle-stop tour through that work. So now over to Nell for some examples.
Right, hiya. So my name's Nell Warner, and I am a researcher in Cascade, and I do a lot of sale-based work. And so when Rachel was putting together this presentation, we thought it would be quite useful to have somebody who had some experience of using this in sale-based projects. So we've put this slide up just to talk about how you can use public involvement in different parts of the research process. And I think some of this has also been covered in earlier presentations. Claire discussed a lot of different stages where you might use public involvement and how public might feed in. It's very different. I mean, I've used public involvement in the sale-based projects, but also in other projects. And I think in the sale-based context, it's a lot harder sometimes to envisage how you're going to usefully ask the public to be involved, because the type of analysis you're doing is quite complicated in terms of the statistical methods, and also you are limited by what is available in those data sets that you've got access to. But in spite of that, we have found quite a lot of benefit at different stages, and we have got some examples of where the public have, or some of the groups that Rachel has been involved with or supported me to access, have actually had quite a big impact on projects. So some of those examples then. So first of all, in terms of the research design, I think there's a possibility of the public involvement in influencing your actual research questions and what you're trying to look at, and also looking at the analysis methods. So they're not going to particularly, the groups you're talking to may not, you're not going to talk about the actual statistical methods, but in terms of the variables and potentially the types of methods, they might have an impact. So in terms of research questions, this is an example. So my current piece of research that I'm working on in SAIL involves children returning home from a period in care. And in talking to public about this, I got much, I spoke to Rachel's parents group, we got much more deeper understanding of the circumstances in where this is happening. So I won't go into all the legal differences, but there's some children who return home with while still technically in care, some children who return much more of an emergency, some, and talking to people who've been involved in this makes you understand some of the things you need to look out for in the data. And that's influenced basically the research questions and how I've defined what returning home is. In terms of analysis, I've finished last year, I think, a study looking at household factors that were associated with the likelihood of children entering care, another sale-based project. And one of the parents, when we were talking about household factors and issues that impact on parents, one of the parents in the parents group, we got onto the subject of literacy issues and the difficulties. This particular parent was dyslexic and had had difficulties reading some of the materials that social services were providing them with. So I included this as a variable in my model, and I wasn't specifically going to do that until we had that discussion. And actually that was confirmed in the analysis that even when we had controlled for an awful lot of other factors to do with social deprivation and so on, parents with some of these issues were more likely to have their children taken into care. So the next stage where you may want to, where you will want to involve with the public is discussing some of your initial findings. This is quite difficult because it's influenced slightly by how much flexibility you have to change your design in with the data you're working with at the time. So, and obviously, I think that's quite an interesting thing for discussion in SAIL, because as it becomes more restrictive, which variables you can use and which, some of the data users are quite specific about what you're using before you start doing the analysis. That gives you less flexibility for actually changing it if the public have suggested that you might want to do something else. So, for example, it may only be when you present your initial analysis about how certain factors have impacted on children going into care that maybe the parents might think, oh, I understand a bit more about what you're doing now, and what about this thing? So, which might be something you could have looked at in the data, but you may not specifically have had, access to it at that point. So, so here we are. So things that can affect, other variables to use. And also the other thing then is discussions about missing data, validity of variables. This is an example from my colleague Helen Hodges, who's also doing a lot of work in SAIL. She has linked a survey looking at the SHERN, which is a survey done in schools, which is now available in SAIL. And she has linked that to children's social care data, but just has found a lot of problems with the linkage due to the missing ALFs. So she's had some discussions with children from involved in or care leavers about how they might have, whether they'd know the postcodes and postcode changes, which will have an impact on their ALFs and their RALFs and various things like that. So that is helping Helen to understand why there might be problems with the linkage. And then you might want to adapt your method to if that identifies some bias or why you might be getting bias, you might identify a method because of that. The next stage really is an interpretation of findings, and this leads on to the issues that we were talking about to do with also dissemination and how you choose to disseminate your findings. So discussions about findings before dissemination to help you understand what you might have found and to think about how you're going to write it up. So I've put a couple of examples here from my work again. So one of these was findings relating to the differential impact of risk factors on female and male adults on the likelihood of children entering care. This was the findings from the research they've already finished and which we discussed with the parents group, and they gave a lot of insights into why they thought that might be an issue, and that's been really helpful because I have also given presentations on that to social services and to Welsh Government, and having that, although I haven't done a qualitative piece of research on that particular issue, at least having talked to some parents about it is something that comes up in those discussions of why this is an issue and why it might be happening. The other example I've put here is from the same study where we had a lot of findings about the differential impacts of some of the risk factors in adults who come from minoritized ethnic populations. Now, this is an example where Rachel, and we were very lucky that Rachel and her team have all this experience and all these contacts with groups that we can use, because Rachel already had set up some work with East, which is a group that work with parents from ethnic minoritized populations about a range of different issues. So we were able to link into that group to talk about some of these issues, which again meant that I was, when writing that up, I'm able to, and talking to other people about it, I have got some more understanding. I mean, as somebody said, you're always going to be limited by not everybody in the group is going to have every circumstance, and that obviously applies to that and applies even by looking at these specific groups. But at least I have more of an understanding when I'm going to talk about this work. We can also talk about the language and how people prefer to be talked about in this, when this is written up. And we also have this advantage that Rachel and her team have already developed this relationship with some of these groups. So when we go to present, not just to East, but to the parents group, it's not coming from me as a person who doesn't know particularly which members of the group may feel comfortable talking about which things. It's coming from people who have already developed that relationship. So Rachel will specifically, I'm thinking about the project on returning home from care, Rachel specifically chose who she knew would be comfortable talking about that, because it might be a difficult thing for certain people to talk about. And then obviously people have talked about disseminating materials. I haven't got an example of anything we've produced that people have specifically looked at, but I have this lovely example of something that our colleague Amy Cummings, who is doing a PhD using sale data, had an additional piece of funding to do some work with our Voices from Care group with Rachel, and they produced this, or co-produced this lovely infographic to explain to young people what administrative data is, which I believe people are able to use. Rachel, you might be able to give a bit more background to that. So I think that is our presentation.